Good afternoon and welcome once again to Black Business and Professional Association's Ask a Professional series. My name is Sandra Whiting and I'm so delighted to once again be your host. We have a very special guest today. Let me tell you a little bit about her. Her name is Lyon Bartley. She is the Executive Vice President. Let me just say that again. Executive Vice President, Health, Safety, Environment, and Quality at Horizon North Logistics. I'm going to ask her just a little bit in a minute. Their company is a leading integrated facilities management, workforce accommodations, forestry, and modular building service provider. And that's a mouthful. So we'll come back when I'll ask her exactly what they do. She holds degrees from Ryerson in occupational and public health. She is a certified registered safety professional. She's a certified professional in food safety and is also IEMA certified. She prides herself in being passionate about safety and sharing her passion with others. And she's won several awards in Women in EHS Awards, Safety Diva Canada Award, Employer Gold Award. She's a diva in health and safety. And before I get into the company, I wanted to say welcome, Lyon, and to ask you, what do you see as your superpower?
Thanks, Sandra. You know what? I think my superpower would just be being able to connect with people and helping them to do better, live and work safer. So I think that's my superpower.
All right. So tell me a little bit about this company. It's quite a mouthful. What exactly does integrated facilities management, workforce accommodation, modular building service provider mean?
Okay, so to break it down for you, integrated facilities management, we can provide a number of services for our clients. So I'll give you an example. The Toronto Airport is one of the accounts that we provide services to. We're the ones doing all the cleaning and disinfection for them. We also do a number of other services for them. So it really depends on what the client wants. We can do food services, security, we do all the building operations with their heating, their HVAC, we do it all. It just depends on what the client really wants from us. We also operate in a number of shopping malls that people go into every single day, and it depends on what the client wants. But in some of those malls, we're doing the hard services, which would be the building operations and maintenance, and then the soft services like security and cleaning and customer service are some of the things we do there. Now, the workforce accommodations piece, oil and gas, mining clients will actually house their workers in facilities. And so we can build those facilities. We can also operate and maintain them. So we will do the food services. We'll do all of the housekeeping. It's almost like a big resort or a hotel, but it's dedicated for the oil and gas and mining clients and their employees. Then the forestry side of things, we actually plant the most trees in Canada in our company across the country. And then we also have our modular solutions. So the City of Toronto is going into some projects right now in terms of making housing available for our vulnerable populations. We're actually the ones doing the building. So you might have seen that on television. We also do a number of the same types of building services for the BC housing out in British Columbia.
Wow. Now, thank goodness you explained all that, because I would never have got that from that title. That's amazing. So I know we want to talk about COVID-19 and safety in this time of COVID, but I know you have a presentation. So why don't you do your presentation, and we ask people in the chat, if you have any questions, put it in the chat. I will definitely ask them for you. And over to you now, Lyon.
Okay, thanks. So everyone, I'm going to share my screen. Give me 2 seconds. And I just want to say hello to some of the familiar names that I see on the screen. So let's just get that shared, shall we? Give me a second. So I'm sharing my screen and we're going to press play. All right, so everybody can see that, and I'm just going to get the chat up so I can see that as well. Give me 2 seconds. Okay, so let's get going. And I'm going to give a little bit of an overview on the company and also just a little bit of an introduction to workplace health and safety. So that just will help frame the rest of the conversation. Okay, so here we go. As Sandra already said, you know, we do lots of different services. So the facilities management, the remote workforce accommodations, the forestry services, and then our modular solutions as well. So this is just an example, the picture of one of the facilities that we have built under our company. And we are a publicly traded company on the Toronto Stock Exchange. We've had a bit of a history. You know, we were born out of a demerger of Carillion, which was a company that actually was a UK company, and now we are Dexterra. We've now merged with Horizon North, so now we're Horizon North, and we're publicly traded on the TSX. We have about 7,000 employees across Canada, and we operate in 11 of the 13 provinces and territories. So that just gives you a sense of how vast we are as an employer in this country. Our health and safety system, so this is just an overview of the pillars that we use to build our health and safety management system. Now, every company, you know, doesn't matter how big or small you are, workplace health and safety is something that you need to think about. And I think COVID-19 has really highlighted how important workplace health and safety is. And so, you know, us safety professionals that are out there in the front lines, been fighting every single day for employees and employers across the country. You know, we're really appreciating just the sense that people are starting to appreciate for the work that we actually do every single day. Next, just giving you a bit of context, but at our organization, we do pride ourselves in this approach about don't walk by, take action now. So this is something that any company can replicate. It's really about trying to get people engaged in the fact that, you know what, we see good things and we see bad things every day. And we want our people to be able to speak up when it comes to workplace health and safety. So, you know, in our company, we pride ourselves on this approach. And as you can see, in 2018, we had over 17,000 entries from our workers, whether it be good or bad. But 2019, we had over 28,000. So you can see the level of participation coming from our workforce. We also have what we call our health and safety credo. So these are really the actions and beliefs that are going to guide us in our organization. We believe that everyone is a safety leader. So I'm just sharing some of this with you in case, you know, you're wondering, like, how can I get some of this going in my own organization? And also, you know, whether you're a business owner or an employee or a manager, you know, sort of look within your own organization and ask yourself, are these some of the things that we're also promoting? And maybe there's an opportunity to provide some suggestions based on what you've seen other organizations do. Just wanted to give you a sense of the team that I lead. So yes, I'm an executive vice president for health, safety, environment, and quality. I have a team of 25 across the country to support the 7,000 employees that we have in our organization. So we cover everything from health safety, food safety, infection control, environmental management, quality assurance, quality control. It all comes under my team, which if you think about it, that's a lot. So let's get into the conversation of workplace health and safety beyond COVID. So this is your last chance. Right now, you can turn back before you take that red pill. So, you know, we're going to have a little bit of fun. I'm going to show you how amazing health and safety can be and just give you some thoughts beyond COVID-19 of some of the things that you can really think about for workplace health and safety. But before we get that going, I want a little bit of participation from the crowd. So we know workplace hazards are everywhere, right? And COVID again has taught us we are dealing with one workplace hazard, which is an infectious disease. And with that comes all kinds of need for control, for standards, for policies, for procedures, for training. But there's lots of other hazards. If you think about any workplace, you are going to have hazards. You're going to have potential for people to be harmed. So what are you doing as an employer to make that workplace safe? What are you doing as an employee to contribute to the safety of your workplace and the safety of those around you? So just going to a little bit of health and safety theory for you, which will just help with our conversation, is that we have accidents, right? We have accidents, we have incidents. And for those of you who are on the line that I see a couple health and safety professionals have joined us, you know this is very well called the accident triangle, right? So we know that the more we have those closed calls and property damages is the more likely we're going to have the accidents and incidents above. But what's underneath this triangle is my next slide. What's really happening underneath is that there is a system. There's a system in that workplace which is collectively built by the employees, the managers, the supervisors, the owners, the CEOs. And if there's a breakdown in the system, we're gonna have the accidents and incidents. Does your workplace value workplace health and safety? And again, I think COVID-19 is showing us that we have to put more value into workplace health and safety, because at the end of the day, we've got to protect the people who are doing the work to make the money, to make the organization what it is. So let's push forward. Who's in the audience? I just want to know, are you a business owner, management, or an employee? What industry do you work for? You know, I'd love to see where our people are coming from on this call. So that gives you a couple seconds to add into the chat box that I, for some reason, cannot see.
So there is Kerwin, who is a safety professional, Maurice, food manufacturing, EHS manager, management, hospitality in Toronto, and Rochelle, an employee. So we have a variety of people. So you can go from there.
Perfect. Thank you, Sandra. That's great. Thanks. And really quick, what do you think how do you think the workplace will change after COVID-19? Really quick, some thoughts, if we could put that in the chat box.
And you could perhaps start making some, nobody's put anything yet. I think we're all, you know, just waiting to have an understanding. So somebody said office workers working from home is a big one. So
yeah, perfect. Okay, so I'm going to move on. Feel free to chime in as we go. So this is what I think. As I look around me, as I look at how things are sort of unfolding, I think there's a real respect for what we call our health and safety rights. So in this country, everyone has basic rights when it comes to health and safety. And as this poster is showing you, we have the right to know about the hazards present in our workplace. So if we think about COVID, we have the right to know, you know, if COVID is a risk, you know, how is it a risk to us? What are we going to do to be able to protect ourselves? We have the right to participate in our workplace. So that's where, again, our Don't Walk By approach at Dexterra and Horizon North makes a difference. You know, people can speak up, and it is okay for them to speak up. And then we have the right to refuse. And again, COVID has really shown this, where, you know, employees have said, I do not feel safe in this workplace, and I am going to exercise my right to refuse unsafe work. Now, every single province has this right to refuse. It might just sound a little bit different, or it might be worded a little bit different, but we all have the right to say, no, I feel unsafe, and there's a process for that, but we all have that right. And I think that's a right that a lot of people are afraid to exercise. And that's where I talk about this fourth right. So the fourth right is the right of protection from reprisals. Again, pretty much every single province, if you speak up for health and safety, or you speak up about the fact that your company is not in compliance with the regulations that are required for occupational health and safety, you will be protected from reprisals. And too often that doesn't get exercised, and people are afraid. A lot of people are afraid to speak up because they're afraid that they'll lose their job. And, you know, I often tell people is that at the end of the day, your safety needs to be first and foremost, and you need to go home to your loved ones. So, you know what, if you really have that gut feeling, you need to follow that gut feeling and stand up. You know, I kind of paraphrased from Bob Marley, but get up stand up for your rights.
Can I interject here and ask you, Leanne, what about when the employer has done all the protocols and there are people who are saying, I don't feel safe, and all the protocols have been done? What happens then?
Yeah, so as I said, there is a bit of a process. So once you do bring that forward to your employer and said, you know what, I feel unsafe, this is why I feel unsafe, you and the employer should have a discussion and conversation around, okay, the employer is going to say, well, here's all of the things we have put in place to make sure we have dealt with that hazard and so that it is safe for you to work. If at that point you still feel unsafe, then it gets kicked up a level, and it gets kicked up a level to your joint health and safety committee or the health and safety representative at your workplace. Now, if that person or that team also says, yep, no, you should be safe enough to work, at that point, it has to go up to the regulatory agency. So here in Ontario, that's where we would have to call in the Ministry of Labor. The Ministry of Labor will come in, and I know they've changed their name and I still can't get the name right. It's Ministry of Labor and Training and Skills and Development. But they will come in then at that point and help make the decision for the workplace to say, yes, it is safe for that employee to continue working, or no, these are the changes you need to make, and then that employee can go back to work.
Thank you.
You're welcome. So next, COVID. Beyond COVID, infection prevention and control is going to be commonplace. So, you know, those of us who work in the industry, we know infection prevention and control has really sat within a healthcare space, or it's sat within food establishments and food manufacturing. But now we're seeing that infection prevention and control standards and requirements are going to be commonplace right across the board. Doesn't matter what environment you're in. You know, I see offices even, oh, we got to clean and disinfect the high touch points. People are touching the microwave, people are touching the photocopier. So we're transferring what we know from healthcare and from food manufacturing and retail into every single environment. And what will also happen is regulators are also going to be starting to ask more questions about infection prevention and control. Traditionally, it's only public health that would really be asking those questions when they come in to do an inspection. But we are going to see the occupational health and safety agencies also coming in and saying, well, how are you protecting the workplace from infectious diseases? Because COVID-19 has taught us that we all have a role to play when it comes to reducing the burden of illness all around. So just further on that point in infection prevention and control, here's just a couple of resources. So the Public Health Ontario has a completely free training program that is on their website. So best practices for environmental cleaning, and it will teach employees, employers, supervisors, what are the things we need to do when it comes to infection prevention and control. So this particular course is kind of geared towards healthcare, but I think if you take it, you really will take away the basics when it comes to environmental cleaning and disinfection. So I've put the link in the presentation. The BBPA will share this with everyone. It's completely free. And what we've done in our organization is that even our general regular cleaners inside of a mall, we're actually putting them through this training. Whereas before we did very limited training, we're realizing that we need to do better as well and making sure they understand not only why they do the cleaning and disinfecting, but what is all of the background, what is all the technical understanding, because when you know better, you do better. And that's exactly what we want our people to do. So I provided just an example of our hand wash sign that we've created, which was actually based on a resource from Public Health Ontario. We got permission from them to be able to reproduce it and use it in our business.
May I interject as well? You mentioned Health and Safety Committee. Go to your Health and Safety. Many organizations who are not directly involved, let's say with food, or don't have such a committee. How do you, is that now a recommendation that every business place have such a committee?
So depending on the workplace, you should have a committee. Now, the regulations would say if you've got 1 to 5 workers, you actually don't need to have a health and safety representative or a committee. And then if you're between 5 and 19, you have to have a health and safety representative, which is one person who will sort of be the go-to for health and safety at that workplace. If you're above 19 workers, doesn't matter the industry, doesn't matter the environment, you are required to have a joint health and safety committee. And there's a whole set of requirements under the regulations for health and safety committees. Now, I said 19 is the magic number. That's for Ontario and a number of other provinces. In Saskatchewan, it's actually above 10 workers. you would need to have the Joint Health and Safety Committee. So there could be some differences from province to province, but essentially the same structure is in place right across the country.
And is this new, or is it now going to be more enforced?
So it's not new, and still a lot of people don't know the requirements when it comes to health and safety. So a lot of people setting up businesses and not realizing how much responsibility and requirements are placed upon them for workplace health and safety. And so this is another reason why we're bringing this to the BBPA, to be able to help the BBPA and their members to understand, because there's a whole set of responsibility. And I mean, there's possible jail time, there's possible major fines for not putting health and safety requirements in place. And we want to be able to protect the members and businesses that are part of the BBPA.
Thank you. Excellent.
Next, mental health and psychological safety. I think, again, this is something that we've been talking about in the occupational health and safety space. The legislation for health and safety only came out, I think I'm going to get my year wrong, but around late 1970s. So we're really only talking the last 40-ish years that we've had the requirements that we have in place today. And so we've focused a lot on the physical health and safety, right? Those are the hazards that we can see. And what we're doing now, and since 2012, when the Canadian Standard for Psychological Health and Safety came out, is we're realizing we have to consider the whole health and safety, which includes mental health and psychological safety. So COVID, with everything going on, we've had a lot of talk about how is this affecting people's mental health and well-being. And, so the conversation around psychological health and safety really has increased, and I think it will continue beyond COVID-19. So I just put a couple of resources that are available. And if you actually, once this presentation comes out, if you click on those photos or the links, it will take you to the resource that is shown here. So how can I help myself? How can I help my team? There's really discussion around how do we how can we just maintain and sustain and become more resilient to deal with the day-to-day life challenges, and COVID-19 is just yet another day-to-day life challenge that we will still be facing for quite a while. I think another thing we've learned a lot about during COVID is government incentives. So lots of resources available to us, and workplace health and safety is no different. So I am speaking more from an Ontario perspective here, but there are government incentives right across for workplace health and safety. A lot of the workers' compensation boards have provided relief for employers when it comes to their WSIB or WCB premiums. That's workers' compensation. But there are also some free stuff just for doing what you're required to do. So in Ontario, the WSIB has the Health and Safety Excellence Program. And as you can see here, there's an opportunity for you to get a rebate if you're paying premiums into the WCB. You can get money back just for putting health and safety in place. And like I said, you have to do it anyway, so you might as well get some money back for doing what you should do. So you can find out more, and we can actually do a whole session on this. I can get the WSIB in, and we can talk about the entire Health and Safety Excellence Program and how will that work and what does that look like and how do I apply. So we can do that as another session anytime BBPA is ready. The other thing is, just launched yesterday, there are business awards available through the WSIB here in Ontario, where you can apply and say, I am an excellent employer and I'm doing everything for my people. And you can win prizes up to about, I think it's $5,000, $3,000, and $2,000. So every year there are companies putting applications in, and I'm pretty guaranteed very few from our community. So, and again, it's probably just not knowing that these things are available to employers to be able to get some relief and money back for doing what's right. Next, so another incentive that people might not know about, but the Ministry of Labor Skills Training Development, I'm sorry if I'm not getting that name right, but they have another program called Supporting Ontario Safe Employers. And through this, you can get recognition from the Chief Prevention Office. And as you can see down below, there is opportunity to get money back. So if you go through the program, you get recognized, you can get money back from the WSIB for putting health and safety in place. So we can also do a session on this, and I'm sure we can get the ministry to provide some more information for us if we so choose. More government incentives. Now this is taking it outside of Ontario. We have what we call the Certificate of Recognition Program, very similar for putting in place a health and safety management system. There is an opportunity in most of the provinces in Canada to get what they call your core certificate, and that certificate will get you a rebate on your WCB premiums. Now, the benefit to core as well is it actually will help you make a safer workplace. You'll have less incidents, less accidents. That is what evidence tells us. So again, it's a program that is just good to put in place, helps you help your business, and you can get money back for doing it. In Ontario, they do have core as well. It doesn't tie to a lot of the financial incentives, but like most provinces, big employers are requiring you to have your core certification in order to bid business. And I mean, I'm talking like TTC, the airport. Most municipalities are starting to require this if you want to do any kind of construction work or projects with them. So similar to what we've seen in other provinces, in order to do work and get some real good contracts, you need to have your certificate of recognition. So it's again, yet another incentive, but it has business benefits when you want to bid certain jobs. And so again, I'm bringing this towards the BBPA because our businesses need to know, because they could be missing out on the opportunity to bid some extremely lucrative contracts because they don't know about these requirements. So why core? It was just some evidence from a study out of British Columbia and Alberta. But like I said, they found that if you have core in place and you're doing the program accordingly, you will have a reduction in short-term disability, long-term disability, fatalities, and serious injuries. So even from a risk perspective, it kind of just makes sense. It's good business. And this is just a little bit further evidence to that it shows that there was, on average, a 12% decrease in those accidents and incidents. And even, you know, I'm just talking about workplace health and safety, but if we were to talk about short-term disability and long-term disability, which is more of an HR thing, you know, you will save money there too. So it is, again, a no-brainer for business that you would want to make sure that you're managing health and safety accordingly. So free, so this is really for employees as well, is that there's lots of free training available right now. So, you know, my son was out of school, and with the whole out of school thing, you know, we got all these resources made available to us when it comes to education, and a lot of free websites that normally we would have to pay for. And we're seeing the same thing in health and safety. So I've put up an example of some of the free courses that are available through the Canadian Centre for Occupational Health and Safety. And normally you would have to pay for these. So it's a great opportunity for learning. It's a great opportunity to take the free courses, get the certificate, add it to your resumes, which makes you more employable, especially to big employers like my company. When people come to the table showing, I've got all this certification and training in health and safety, that will get you in the door faster than the employee who doesn't have it. So, you know, I'm just imploring on people, take advantage of free. Like, I love free. The other thing Ontario launched in July is if you are currently out of employment, there's free health and safety training available to you in the province of Ontario. And I've put the link there to the news release that came out from the government of Ontario. So again, take advantage of the free, because we don't know when the free is now going to turn to thou shalt pay again. The thing I hope beyond COVID is that they will continue with some of these free opportunities. Now, the other thing I'm starting to notice is, and you know, we're all starting to figure out, well, here's the new way of doing things during COVID-19. But what I'm starting to tell businesses, employees, employers, start thinking about, well, what is the new way we're going to do it regardless of COVID-19? And if we look at the photo of the bus driver, so you know what, way back in the day, Bus drivers used to have the plastic shield, right? That would house them in their driver's space. And then it came down. And part of the reason why it came down is because, somebody probably thought, it's not as inviting to the guests or the customers coming onto the bus. But what we're now doing is going right back to where we were before. So we've put the barrier back up because of COVID-19. We know that it's safer for the driver, less likelihood that you're going to get any illness transmission if you have the barrier up. But I say leave the barrier up. Don't go back to the way it used to be, where it used to be more open, because this not only makes it more safer for the driver from infectious diseases, it's also safer for potential workplace violence. I know TTC operators who have said people will spit on them, yell at them, all kinds of workplace violence. And I think this actually provides that added protection. And so I hope we don't go back to taking those barriers down. So the other picture below is just an example. Now we go to the supermarkets, we go to stores, everybody has up the plastic shield. And again, very similar reason to leave it up. I think it will become an added protection for security and safety. So I hope they leave it up and keep things a bit safer for the operator on the other side. Another example that we see out there is restaurants. Lots of restaurants now have turned their menus into a QR code, right? So you go up to the table, you have to use your cell phone, you're gonna scan the QR code and the menu is gonna pop up on your phone. Now, I think this is another thing. Don't go back. Don't go back, because this makes it more safer, more effective, and more efficient. Now you don't have workers having to handle all these menus. They don't have to clean the menus. They don't have to replace the damaged menus. So by all means, still have the menu available for people who cannot or will not use the technology. But this will make it more safer and more sustainable if we get rid of those menus. Another example that I've seen, I was recently staying in a hotel for work, and I started to look at that environment. I said to myself, there's real opportunity here to change the service delivery. Why should a cleaner have to go into a room every single day and have to handle the bed and do all this manual handling work? Why? If I'm staying at that hotel for multiple days, maybe it's only every other day. That will make it safer for the employee and also still provide a good level of service to the person staying in the room. And in our environment, we do workplace accommodations in oil and gas and mining. And I'm trying to suggest to people, let's not go back, because right now we have reduced the level of service to make things safer for COVID-19, but it actually will have an effect on the workers having to do the work as well if we continue the reduced level of service. And if we can get customers understanding a new expectation, it will in turn help the employees. So I wanted to provide a couple of health and safety resources for COVID-19. Lots of great free stuff, lots of great information available on these websites. And there's lots more resources that I could provide, but I just picked two. One from Workplace Safety Prevention Services here in Ontario, and then the Canadian Centre for Occupational Health and Safety, which is a national and federal resource which covers all kinds of topics on health and safety that would be widely applicable across the country, regardless of where you find yourself. And then the other thing I wanted to provide is just some additional resources. If anybody wants to learn more about health and safety, here's some great books that I myself have read. So the Occupational Health and Safety book by Diane Dick, she's actually a Canadian author. And if you get that book, it's got a flood of resources and information available for employees, for managers. If you want to know anything in terms of how to manage health and safety or how health and safety should be managed, that's a great Canadian resource. Next, we have the Healthy Workplace. So this just understands, again, health and well-being and how do we apply those learnings and understandings in the workplace, because we know that the healthier the workers are, is the more productive they can be, is the safer the workplace will be, the better customer service they will give. So it is it is business sense to invest in your employees' overall health and well-being. The next two books, The Supervisor's Guide to Safety Leadership and Safe by Accident, is written in part by Judy Agnew. She's actually working out of the US, but she's a Canadian. And she's written these really simple, easy to read books on how to do health and safety. And The Supervisor's Guide to Safety Leadership, that one for me is really a good book, because too often people are put into these leadership roles as a supervisor and they don't really know how to supervise. So this book gives some really great learning and understanding on how to supervise people. And then for the employee, I say, you know what, read that book too, because sometimes managing upwards is the way that we can get things done. So if you arm yourself with more knowledge and understanding of how things should be, you can maybe influence and make some changes in your workplace that will help everyone, including yourself. Next, I have to talk about food safety, because I think a lot of our businesses in the Black Business Professional Association do fall into the food category. So the Food Safety magazine is free. If you go onto their website, you can actually get a free subscription. This is their most recent. I just read the article on preventing virus transmission in food service establishments. So again, great information on how can I make my workplace, how can I make my food establishment better and safer for not only my employees, but the guests coming in there as well. And then a pretty standard industry book now is How Do I Create a Food Safety Culture? And it's very similar to how we create a health and safety culture. And so this is another resource. When they share the presentation, the links for both of these photos are live, and it will take you to where you can access the information. And my last good read indeed, this book is one of the books that all of us health and safety professionals should know and read, and we've learned of in school. And Frank Bird was one of our great theorists when it comes to health and safety. So this book is actually something that a very large oil and gas company used to require for all of their leaders to have to read. I provided the link. Great resource if you want to learn how do I reduce the loss when it comes to health, safety, and environment. And launching very soon, coming to a BBPA member, is that we're going to be providing virtual support to members of the Black Business Professional Association. So myself and Kerwin, who's actually on the line, and a couple other health and safety professionals are going to be there at the end of this line or the form that you complete to be able to answer any questions or support that you need for workplace health and safety, for workers' compensation, for food safety, for infection control, for industrial hygiene. We are going to be there. We're volunteering and providing our time as a way for us to give back. The team that I've put together, they're fantastic OHS and public health professionals, and they really just want to be able to give back and volunteer their time and help others who just might not be able to afford the likes of me and Kerwin and the rest of the team. So we're providing this free support to the Black Business Professional Association members, and it's our way to pay it forward. So all you would have to do is click the form. They're going to be working on getting this on the website as well. And you can fill out your form really quickly, provide a really brief description of what your question or inquiry is, and then we'll reach out to you and just help you and provide some support. We can't do it for you, obviously. That's really going to be for the workplace to have to do the work, but we will help guide you and point you in the right direction. We can provide you resources because we have a flood of stuff available at our fingertips, having done this for so many years. So I see Maurice is on the line. I haven't pulled her in yet, but Maurice, I'm going to come call on you because maybe you can help us out with anybody from Quebec. And this would be national support that we can provide. So that is coming to a website near you for the Black Business Professional Association. So it's another great reason to get your membership, which is super affordable and gives you some really great added value. So, I hope that you guys can take some time to Connect with me on LinkedIn if you haven't. Follow some of my hashtags. So hashtag safety by positivity and hashtag talking HSEQ Tuesdays. So the Talking HSEQ Tuesdays is something that my company is actually putting out every week to provide just some really basic information on health and safety, environment, and quality that is really just there to help spread the awareness so that people can learn more about this vital piece of every organization that should be managed. And then, of course, you know, I implore you guys to read some of the good read and deeds that I've put up there, and reach out to me on LinkedIn. I'm also on Twitter at Safety Diva. You can learn more about me in a recent article that was put out in the Canadian Occupational Safety magazine. And we're here to help. You know, one thing I often talk about is work is such a vital part of life, right? If we are fortunate enough to work, it is part of that overall health and well-being. And it needs to be done safely. It needs to be done where work is not going to cause harm to you. And we spend so much time at work. And in most cases, we spend more time at work than we do with our loved ones and at home. And work shouldn't cause you harm. And so we're here to help. And we want to make sure that our people know how to make things safer, not only for their workplaces, but for themselves and for the workers that they work around. You know, we have to care for one another. And so here we are, we're here to help. So that was really it in terms of the information that I wanted to go over. I didn't want to take too much time. And I've left some time for any questions, suggestions, ideas. Here's an opportunity for us to collaborate.
Wow, thank you so much, Lyon. That was amazing. I have a few. Now that you talk about work being so important, but we now realize a lot of people have had to work and shift to home. And I believe that the mental health factor in wellness and health and safety is going to be one of the big issues for workers working from home. Any ideas of how do you tell employers, how do you work with employers with this shift of mindset? Because it's going to be challenging. There are those who love it, who think it's the best thing since sliced bread, and there are those who are dreading it. They live in small places. They feel there is not a division of work and home. They're working longer hours. They feel they're on call all the while. What rules and do you think need to be put in place now with this shift?
Yeah, so thank you for that. That is definitely one of the things that will probably continue for most of us beyond COVID-19. And I think employers are going to have to get used to the idea. So I can tell you, we had a very long conversation at my workplace about what are we going to do when the COVID-19 dust settles? Are we going to allow our employees to continue working from home? And I think to some degree, we're not going to have too much of a choice. You know, there are human rights legislation as well that would say, employer, you need to accommodate your workers up to a point of undue hardship. And that point of undue hardship is hard to really establish and prove. So if we've been able to continue our businesses with our people working from home since March until now, and a lot of employers are saying till the end of 2020, people will be working from home, it's going to be hard to disconnect that going forward. So I think companies, if they don't already have it in place, need to make sure they establish the right policies and procedures around how will the working from home work. You know, because there are risks that you're going to need to control for. You know, workers can claim workers' compensation claims working from home and say, it's because I work from home. If you slip and fall at your home, you could actually potentially get covered from workers' compensation, but there are ways to mitigate those risks. The other thing I think as well is that not everybody can work from home. So I think employers need to also keep that in mind and make sure that there's still a space available for people to be able to come into. And in our workplace, what we've done, we actually never officially closed the office because we did have some employees who came forward and said, I cannot work from home. So they were very able to still go into the workplace. Mind you, there was hardly anyone else in there. So in terms of physical distancing and all those safety measures, it wasn't an issue, but not everybody could work from home. So I think you need to still accommodate that. Now there's the social aspect of work. that is also important for our mental health and well-being. So how do you do it? How do you still bring people together? And I think, you know, there's going to be a way to do it by bringing, maybe every now and then your team meeting is going to be in the office as opposed to virtually. You know, there's a lot of evidence to show how can you engage in people virtually and still have them feel connected and a part of the team. Microsoft has actually done some interesting work on that. One of the things they even talk about is that for some people it's overwhelming. It's too much stimulation when you see all of the different backgrounds. And so Microsoft is actually coming out with where you can put in place, everyone's going to have the same background. So even that might make them feel like they're more connected in a community. One of the things I did with my team is we had done so many of these virtual meetings that after a while it just was like, oh God, not another virtual meeting. And I flipped it and said, let's have some fun. So because everyone was at home, I said, let's have a show and tell. So everybody's going to find something from their home that they don't mind sharing with the rest of us. And it turned it into more of a connection where we were still able to connect to one another, which is an important human factor, right? We need to socially connect. So there are ways to be able to navigate the working from home while still feeling connected. But the biggest thing is companies need to really establish what are the policies and procedures and requirements going to be, because this is not going to end.
Yes, anytime soon. Yeah, I do think that that is one of the major things. They will have to be rewriting all their job descriptions, and this notion that people are totally on call all day, anytime. You know, the time when you would go and have a coffee with a coworker and shoot the breeze, you know, you do need that little up and down time. So anyway, that's one. One of the things I have a real challenge about, and I was in charge of all the food vendors at Harbourfront Center for many years, worked long and hard with public health. And the one thing I hate to see is anybody serving me with gloves. Okay. And the reason is this myth that I have on my glove and I am safe. And the public health people said that they agreed, but people have got it into their head that it's safer. And of course, it depends what you're holding. I'm not trying to say. And then you would see you go into a shop, they serve you with the gloves, and then they come to the cash register with the same gloves, and everybody goes, but I have on gloves. What is your tip for that? I refuse. I make them take off the gloves, wash your hands, please. I need to see your hand that was washed. I cause a lot of fuss when I go to these places. What do you think?
Well, Sandra, that's excellent. And you just did a perfect example of our don't walk by approach. Is speak yes. up, say something. Yes. You know, so I do a lot of food safety training, and one of the things we often talk about is the glove use, right? So we always try to remind people the glove use is not about your protection. We're actually trying to protect the food from you, nasty food handler. You know, because a lot of foodborne illnesses are actually transmitted by the food handler itself. You know, so the gloves protection is for the food. So if we can get people to think about why are we wearing the gloves, you know, it can help with performance. But then, of course, you have to monitor. You have to continually train. And the problem is because of the flip side. When we're at home, why are we wearing the gloves? We're wearing the gloves for our protection, right? Because we're doing cleaning. We don't want to touch the chemicals. We don't want to touch the toilet. And so it's a complete flip when we're working in a food environment. And you know what, there's evidence to show that yes, you know, proper hand washing is the way to go. We all know that thanks to COVID, that is the best defense. Wash your hands, wash your hands, wash your hands. But the gloves actually can serve a purpose as well. And interestingly enough, in the US, that's a requirement. If you are touching ready to eat foods, you have to wear gloves. So a lot of companies that operate in both US and Canada have brought that requirement up to Canada as well and say, thou shalt do it. But it's all got to be about the training and the execution, because it can work and it can actually be safer for the food handling. It's just, you got to get it right.
And you have to change that glove every 15, 20 minutes. Yeah. And they don't. So anyway, the other one I wanted to ask your thoughts about, when you go into public bathrooms or in companies, in malls, they have these wonderful things that you press to wipe your hands. I think they are germ ridden. Am I right or wrong? I would never put my hand under any of those things that are still in many places of business. What's your thought?
Yeah, so speaking of beyond COVID-19, I think a lot of things are going to change in the way we design and construct and build, and washrooms will continue to evolve. The more touchless you can make the public washrooms is the better it is. And that's because, I mean, if you actually wanted to see what these washrooms look like under a microscope, you would. And I mean everything, you know, even just let alone from the toilet spray that comes out and actually will go all over the washroom. You don't want to see it under a microscope. So my biggest advice is really, as much as you can, handle it as little as possible. You know, it's great that we all are walking around with our hand sanitizers now. One thing I tend to do is I'll actually advance the paper towel if I have to touch it first, then go wash my hands, because then I'll have the paper towel to grab with clean hands. So that's a simple way to do it. You know, the taps, you know, again, use the paper towel after you've dried your hands to turn the tap off, and hopefully we'll see more and more of the automatic sensors in the washrooms and the paper towel dispensers and so on and so forth. I think
answered me about the one though, no paper towel, put your hands under and this air comes out.
Yeah, you know what? Evidence would show that it's okay. And again, you got to watch how you're doing it. Try not to touch anything like those Dyson ones, right? It will show that it's okay. But you know what the interesting thing is, again, when I talk about how contamination goes everywhere, those hand dryers are actually pushing contamination out all over the place.
The hand towel is actually, the paper is actually better.
Yeah, the paper, in my opinion, is the better way to go, for sure.
Okay.
So, and I will always, thankfully, you know, if there's a washroom that has the choice, paper or hand dryer, I'm going for the paper.
Okay. I was on a side. How did you get involved? We have a little bit of time. How did you get involved to be so safety conscious and get into this field? And how can somebody get into it if this is something they see as a potential career?
Yeah, for sure. So, you know what? Safety professionals are like the thing. It's one of the professions that's actually listed for new Canadians who want to come here. So there is going to be more and more of a demand for safety professionals. My way I got into it is that I love science. And so when I was coming out of high school, I knew I wanted to do science. I just didn't know what. And I bucked upon, as we say, I buck up on the occupational and public health program at Ryerson, which had a broad spectrum. Like it had to take everything, almost everything that ends in ology. I had to take it: epidemiology, parasitology, psychology, you know, entomology. I mean, the list went on. And I figured after that, I might figure out where I want to go, you know, in terms of a career, because then maybe it'll help me target. But it was science, and it wasn't doctor, it wasn't scientist. I wasn't sure what it was, but I knew it wasn't that.
Wasn't
or nurse.
Our profession. You know how parents want lawyer, doctor.
Yeah. And you know what? A lot of people said, oh, I should be a doctor. I'm smart enough. And you know what? I think I am, but I just didn't think that was really my calling. Now, at the same time, I was working for Loblaws. I worked for them as a cashier from the age of 17, and then through university. And so I think being in the food environment also helped shape the direction of where I wanted to go. And so, that was really it. And most of us safety professionals, we have a background in engineering or science or, you know, construction. I mean, the list of opportunities is far and wide. And it's also a career where you don't have to specialize. We can be generalists. And as long as we learn the industry, we can apply what we've learned anywhere.
Mm-hmm. And I'm noticing now that COVID has, you know, changed our lives. Banks, for example, are hiring, you know, safety and professionals. Why would a bank need to hire safety professionals? And now that is becoming a career that definitely is just going to explode, because everyone needs advice, how to set this committee, how to make our place of work safer for the public and the employees. So wide open.
Yeah, it is. And I think what happened is the banks probably found themselves a little caught with their pants down to some degree. So now you have regulators coming in and asking questions about how are you doing this, how are you doing that? And they're realizing they probably always thought, oh, I don't need to worry about safety. I'm just a bank, But people are realizing it doesn't matter. It doesn't matter the workplace, doesn't matter the environment. You will have workplace hazards, and you're going to need to put the policies, the procedures, the training, the standards, the requirements in place. And you're going to need to figure out if something were to go wrong, how do we react? What are our emergency procedures going to be? And that's exactly what we bring to the table as health and safety professionals. I mean, the amount of stuff we have to cover is unbelievable. And that's it's also a work where you have to continuously learn. Like all of a sudden I find myself learning about nanotechnology and what are the hazards, because now that's going to become a thing.
Okay,
So,
you have to tell me, what is nanotechnology?
Yeah, it's technology about very, 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 very tiny things.
You learn something new every day.
Right.
I do want to ask you before we go though. Kerwin said, is there an incident cost calculator for safety incidents in Ontario?
Yeah, so Kerwin, the Institute for Work and Health has a cost calculator similar to WorkSafe BC. So you can check that out, Institute for Work and Health, IWH. And that one's a pretty good calculator to use, and it's pretty broad that you could use it in any province. Another cost calculator that they have is, so some of the government incentives that I talked about, there are actually calculators on there to really be able to figure out how much money can I get back. So there's a couple.
Okay, and he also recommends a great book, The Emperor Has No Hard Hat, by Canadian author Alan D. Quilley.
Yes.
Sounds interesting.
Yeah, Mr. Quilley is a great historian almost to some degree when it comes to health and safety. And if you're not following him on LinkedIn, he's a good one to follow on LinkedIn.
Mm-hmm. One thing I hope happens is that, and this comes from my storytelling background, that we tell the stories rather than give just the facts and the figures, which can overwhelm people. You know, the hand washing with the little drawings have really made a difference that public health has put out, because a lot of people did not know that it takes so long to wash your hands.
Mm-hmm.
You know, I would assume most people didn't know. You have to sing the birthday song, is it twice?
Yeah. And what I would always say to people is sing whatever you want. Just sing it for a while and wash those hands.
Yeah. So thank you very much, Lyon Bartley. You have been a fountain of knowledge, and very impressed with the work that you're doing. And congratulations to being part of the BBPA proposed initiative. I really like the idea that people can, in fact, get some help, because it is a big topic, and we're all stressed out and overwhelmed, and it's good to know that you're helping to make a difference going forward. And thank you for everyone on the line for being here. Please note that the Ask a Professional is held every Wednesday, 12 noon. We look forward to seeing you again. And again, thank you, Leanne, very, very much for being here.
Thank you, Sandra, and thank you, BBPA.
Okay, Joan says, excellent presentation. Thank you, Joan.
Thanks, Joan. I think I know which Joan that is. Thanks for joining.
Joan W. Thanks, Leanne, very, very much. Really, really good of you all to be here. And remember, all this information will be posted on the BBPA website coming soon. Thank you all.
Thank you.